to the end of another busy day. You just saw 20, 30 patients, maybe more. Instead of heading home for dinner with your spouse or playing with your kids, you now begin your night job, charting. Charting is critical for patient care, billing, and medical legal liability, but it steals our focus from our patients, eats away at our time with our families, and keeps us up at night. The burden of always having another chart to complete drains all of us. Freed listens, prepares your notes, and writes patient instructions for you. Charting is done before your patient walks out of the room. Wait, because it gets better. Freed learns your style over time. It's AI, just like a human scribe would, except it will never quit on you. Freed is loved by 3,000 plus clinicians from every specialty. It's HIPAA compliant, takes 30 seconds to learn, and costs only $99 a month. You can try Freed for free right now by going to freed.ai, Freed.ai. Listeners of the Physician's Guide to Doctoring can use the code PGD50 for $50 off the first month. Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle.
I'm so excited to introduce our guest today, Sam Horn. Sam is a seasoned nonprofit director with extensive expertise in healthcare and sustainability. Since joining the Floating Doctors Medical Missions team in 2019, she has been dedicated to serving at-risk populations. Passionate about elevating NGOs, Sam focuses on international development and communication and really aims to enhance visibility and productivity on the ground. Sam currently lives in Bocas del Toro, Panama, with her partner and 3 children, leveraging her expertise to drive impactful change in underserved communities. And she's here today to share valuable insights and practical advice on how doctors can get involved and make a difference through medical missions. Welcome, Sam.
Thank you so much for the warm welcome, Dr. Kristine. It's really exciting to be able to connect with you, connect with your followers, and have the opportunity just to talk about something that I feel so passionate about, getting doctors connected with serving and finding how to serve in a sustainable, ethical way in these developing areas. So thank you so much for having me.
Absolutely. First of all, connecting with people from Bocas. Everyone knows Bocas is my favorite place on earth to live. And so I'm excited that you're here to give us this information. Just to start off, I'm just wanting to learn more about what inspired the start of Floating Doctors and what's led to it becoming the NGO that it is today.
So Floating Doctors was founded by Dr. Benjamin Lebreau. So he still is involved with Floating Doctors. He acts as our founder, of course, and also as our director of global affairs. So he still does quite a lot of networking on our behalf and presentations and leveraging his global connections to bring more support to Panama. He originally went to medical school in Ireland. So he graduated and then shortly after was actually traveling in Africa, where he found in those small communities how little access they have. And he just happened to be stopping on a tour, and where the tour guide said, do you want to see a local community? And he's the yes guy. He's the nicest guy you will ever meet. He would say yes to anything. He's just the dreamer of our mission. He went to go see it and he realized okay, I have my backpack, my little first aid kit, and he was well out of everything. And, that was a long time ago, over 15 years ago, and he still does remote consulting for that community. So there he realized his love of providing to these low resource settings. And he actually has his undergrad in marine biology. So he's a marine biologist, also a physician. So he was able to bring his love of medicine in the sea to found Floating Doctors. He originally envisioned Floating Doctors being more of a disaster relief mission. So they bought supplies to remodel a donated sailboat that was pretty much falling apart. For a year, he and a team volunteered every day, used all of their personal resources, all of their money got as much money as possible just to put into this boat. And then they sailed to Haiti when the first tragedy struck there, and they actually only traveled combined with $11. And that's just how the mission grew of look at all we can do with just a team and get transportation. They made it work, and they were doing this natural disaster relief kind of medical setup when there were officials from Panama that called us here. And that's when we really found the need to make a base here in Panama and Bocas del Toro. There are numerous coastal communities that need ongoing support. We have chronic patients, which again, those of course are those patients that need continuous support. It doesn't mean they're going to get sick and die. It just means they need continuous tracking. They need continuous medication. We need to stay in touch with them. We need to check their vitals. They need health education. So that was chronic was an unknown terminology when we got here from our patients. So not only was it, okay, we can prescribe you for diabetes, we need to tell you what that is and let you know that you're not going to die. You can take this pill every day and live a healthy, normal life. Because most people at that point thought if they're sick, they will either get better or die. There was a really hard time to re-emphasize this point of you'll be okay. But even when you feel okay, you need to keep taking this medicine. So that's been a long-term goal here in Panama. And we haven't quite worked ourselves out of a job here yet. So that's when we kind of rerouted to have a site here. And we have a permanent base here now.
Wonderful. Wonderful. And it sounds like such a needed community that you kind of established this stronghold in. And so what is your role at Floating Doctors and how did you actually get involved?
So I actually came to Floating Doctors in 2019 as the volunteer coordinator. We have short-term fellowships that are geared towards all countries, and it's basically a long-term opportunity to volunteer. So these now are fellowships that we've accepted up to 32 countries that have come and work with us. Right now, our team consists of 7 countries. And so that was what I wanted to do. I wanted to go to a new place, volunteer, give back. I was not a doctor. I was not a native or advanced Spanish speaker, but I had a big passion to learning more. I had just graduated from college in North Carolina. And I had grown up in my bubble and I loved my bubble. My bubble was very comfortable. I have 0 complaints about my bubble, but I realized that, okay, I have an undergraduate in psychology. I need to go back to school, but I don't know what I want to do. And how can I decide what to do with the rest of my life if I've been in my bubble my whole life? So I just found Floating Doctors looking for a long-term volunteer opportunity where I could give back and be useful. You know, I didn't want to go somewhere and be just a waste of space. I wanted to be able to hands-on contribute. So I came in as the volunteer coordinator. The volunteer coordinator is an on-site position. So Floating Doctors, we host our volunteer coordinator. So they hosted me at their base. They provided my room and board, which included food as well for the week, for going to clinics when we're at the clinics at our base. And then I kind of just fell in love with the organization aspect of that. I'm very organized. So I was able to easily do all the volunteer coordinator tasks of contacting new volunteers, of adding everyone to a group chat, of going over the locations where we meet everyone. Those tasks I could make a little bit more efficient and quicker. So I was able to do all of those admin tasks in an hour. And I was like, okay, you know, I can do more with this. Like, let me keep going and let me try doing some more things. So I kind of just looked around our base and tried to find some of those gaps to support the team, which led to me helping with finances, led to me helping with some of the organizational aspects, such as the communication within the team, or how the packing and the organizing of the clinic went. So I was just trying to be useful and trying to use my skill set and also let those people who have a skill set that I don't have use their skill set while I could cover those pieces. And then towards the end of 2019, unfortunately, Floating Doctors did go through a rough patch where we lost a lot of our funding and a lot of our volunteers that we were planning on having were not able to come. So at that point, our organization needed to send home the staff that were currently there with the volunteers that were currently there. But I did stay to help kind of stabilize our operations. We needed somebody on the base. We still had 17 employed local Indigenous Panamanian workers that we needed to keep busy. We needed to kind of just sit back and strategize on what did we learn from this? What can we do better? So I just had the opportunity to lead those efforts along with 2 other members of our team who stayed back. That was a really eye-opening experience where I realized I like this and I'm pretty good at organizing these things. I'm good at strategizing and trying to work with a team and trying to take advantage of everyone's skill set. So I started at the beginning of 2020 as the executive director to welcome back our fellowships, start accepting volunteers again, and just kind of take off 2020 running. And then COVID happened. So I was kind of ready to start 2020, success, no failures. And then 2020 happened where we had to send all of our medical staff home as they were really recalled to their home countries to act and work. And our volunteers couldn't stay short term. So then we had a very small team during COVID. Ever since that, I've had a big challenge. There's been COVID. There's been a lack of funding. Our solar panel system is not working. There's always such a big challenge that it just wakes me up every day with a big motivation. So I am the executive director currently. I originally had a 3-month contract, which turned into a 3-year contract, which has renewed to another 3-year contract. So I'm just staying here until I can feel like it's stable enough, but I have a lot of challenges that I have yet to overcome.
Well, thank you so much for that beautiful clarification of your journey. And it just shows how much passion you have for this community and for this group, this mission. I'm so curious about, you talk about the challenges and the struggles and losing funding and having to send volunteers back. What do you do to actually make missions work a viable income source? What are the primary sources of funding? How do you kind of secure and manage these?
So what we're doing currently, I wouldn't say is working 100% exactly how I would want it to work, because we still have moments where we don't have enough money to cover the expenses of that week. Our operational income, that comes from the volunteers. So our volunteers come and then we pick them up on a Sunday and their volunteer week is until Friday afternoon. And they pay a contribution and that actually covers all of their expenses. So that covers where they're sleeping, the food they're eating, the boat that's taking them to clinic, the medication they're giving out at clinic, the translator who's supporting them in the clinic. So all of the day-to-day expenses are facilitated throughout the volunteers. We do need 16 volunteers though per week for those costs to break even. So last week we had 2 volunteers. So it was a very financially difficult week for us as we still had our fellowships, our staff to send to the clinic. We still sent those 2 volunteers to the clinic. We ended up seeing the same amount of patients. So we still had the same costs for medication, for gas, for our local staff that we employ full time. So the costs don't really change when we have less volunteers, really except minor changes for the amount of food. So that is the goal. We're trying to create a sustainable healthcare clinic and program that when we have volunteers, they're covering their costs. So then we are not looking for funds every single week just to cover the living costs of people that are coming. People are coming and they're covering just their costs. That doesn't go towards admin. That does not go towards a project in the future. It goes towards their costs. So with our admin costs, with overhead costs, those are outside funding sources. So we have partners in the United States and donors. We do recurring donations, which are always very helpful. We have about 6 donors who give a one-time donation throughout the year, which really support us. And then we also have a couple of grants that we typically get on a yearly basis. Right now, it is working, but it's not quite enough for us to kind of breathe easily and say, we're good. We don't know if we're going to get those grants sometimes. We're always looking for other grants to expand our programs, because right now with the donors that we have, with the income that we have, it covers the cost that we have. So when we want to do a new program, we want to expand our HIV testing, we want to reach out to more local midwives with training, that's when we have to do an external grant or look for more support. For example, I've just been working with a Rotary Club in Boquete and in Atlanta, and we've received funding to have a program to train local midwives. So we'll be training local midwives in a community that's about a 3-hour boat ride away. They're on the mainland, but these communities cannot access the main road. So these are coastal communities. These are midwives that are doing all of the births at home. So we're trying to teach them a lot of prenatal care, postnatal care, but also respect their native tradition of how they deliver, how they prepare, what are their natural remedies. So it's a really big opportunity to be able to do that, but it's a very expensive program to run. And I don't think that is well known how much it costs to have 17 local employees, how much it costs just in gas. We spend $1,200 a week just to fill up the boats. So it is a costly program and it's not easy, but we're always looking for volunteers. And that's the most sustainable way to cover the costs.
Is to have those volunteers be present to cover their costs and the medications and things.
Yes.
Wow. There's the financial aspect, which of course is a very important aspect of the mission's work to allow it to carry on. How do you also ensure the sustainability of the operations in these remote and underserved areas in terms of the healthcare delivery itself and the community development?
So a lot of the healthcare delivery comes from, we want to build capacity within the communities. So it is important for us to go to the communities to provide education, to provide medication, to be available. But also it's not our main goal to go and say, okay, you have this problem. To say, okay, so you're telling me you have a headache and you're also telling me you drank 1 cup of water today. Do you have access to more water? Where does your water come from? Have you ever boiled water before? And so not only are we trying to treat their problems that day, but we're looking at this long-term planning of what is the stem? Where's the root of the problem coming from? So we've done a lot of capacity building projects with water filtration systems, with literacy programs. So then it's not only the actual healthcare we're delivering, but it's the education and economic opportunities. And then this is where we see the change. We see the change in almost working ourselves out of a job, trying to enable these people to have these solutions without us. So we're never going to go in and say, okay, we're just giving handouts. We're giving hand ups. We are meeting in the middle to build this connection. We're partners. We're equals in this relationship. It's an equally and mutually beneficial relationship.
Beautiful. And so how are you able to do that? Like, how are you able to engage with the communities that you serve to ensure, as you mentioned earlier, that the programs are culturally appropriate and are actually meeting their specific needs?
We try to get a lot of feedback from the communities. Something really special about Floating Doctors is we go to the same communities every 12 weeks. We do this so that we can provide recurring care, and also we can do family planning, which is a birth control shot injection. So then that way we're able to follow their cycle. So whenever we go, we give a 90-day supply of any medication needed for chronic medication. And then we do our family planning on that 12-week cycle. So we see 24 communities, and each community we go to on a 12-week basis. So there are some communities where some weeks where we go to 3 communities that week, or a very far away community that we only go to 1 that week. So something really unique about that is when we go to these communities, it's always with different volunteers. The volunteers that are at the communities we're at this week, they are not going to be the same volunteers that go in 12 weeks. But to the communities, that doesn't matter. That piece is not important because we're going as Floating Doctors. We are showing them our consistency by returning every 12 weeks. We'll travel if it's raining. If we have no volunteers, we will still go. We're able to earn their trust by that continuous recurring appointments that we're basically giving, we're making. They're going to see us no matter what. And with that, we have their trust. So with their trust, we also have a better open line of communication. So if we're trying to do a project, if we have an idea, we have the ability to have a good conversation with the people. And they know, if I ask them for something, they know they don't have to say yes just to keep us going. They know that they can say no, they can say, we don't want to do that, or they can say, we don't understand. And that doesn't mean that we're not going to come back. That doesn't mean my feelings are hurt, so we're not giving free healthcare. It has nothing to do with that. We're asking them, what are the problems that you see and how can we support you? And then we can have an open dialogue on what that would look like. What would those barriers look like? We also do community needs assessments. So when floating doctors first came, we did, of course, them were the communities we were starting. And we've been trying to do those on a recurring basis so we can keep seeing what is changing, what do the communities want, how can we better engage the communities? And then we can compare that with our patient data and their feedback to see the issues that we are seeing as our medical team can see what those issues are versus what they're saying. There are some communities that are saying one of their biggest health problems is the diet. They don't have a lot of options for their diet. So we're seeing that. But then when we look at the data, we could see something different. So it's interesting to get their feedback and compare it to our data and see if they're in alignment or if they're separate. And either way, we can use that as an opportunity to talk with them more about trying to address their medical needs and also the spoken, communicated needs of the community.
I'm just thinking about the process and you mentioning the team members, which they may be different each week, the volunteers, in terms of who's working with them. How do you maintain, consistency in terms of recruiting, training, retaining your team members and volunteers, particularly those who are, willing to work in different environments?
That's a great question. And for sure, something that we're always trying to improve, because I think it's difficult for our long-term fellowships, those people staying for 6 months, staying for 12 months, as they come and they have enough context to really be able to have some long-term big picture ideas. And we don't want that to get lost after they leave and then someone else come with something similar. We want to take advantage of their ideas, their feedback, and use that to improve the program. We are always in a state of improvement, trying to grow. So for volunteers, we always try to give them as many materials before they arrive as possible. So they'll have an access to our treatment guidelines. And that basically is just showing what we see in the community, some of the common presentations, but also what are our guidelines? What is the first line of treatment for deworming? What is the first line of treatment for hypertension? What is the criteria in this patient model? Because it's different. The criteria is going to be different from a lot of people's home countries. We have a treatment guidelines that shows how we take care of our patients, because as much as we want to accept medical and non-medical volunteers, as much as we would love the opportunity to have doctors work with us from many different countries, we would never accept a volunteer just to have more volunteers, but jeopardize the ethical level of the care that we're giving. So we could never sacrifice that care just, let's get more volunteers so we have some more cash inflow. It's not like that. The patient care is the top priority. The level of care is the top priority. And the continuity of the same level of care is very important and something we take very seriously. So in every clinic, we have one of our lead medical providers. So those are one of our fellowships. They're here with us for a minimum of 6 months. Typically, it's closer to 9 to 12 months. And they're basically floating around the clinic. So they're called the float. There are going to be 4 to 5 provider stations. And that lead medical provider will be afloat. And they'll go around to make sure that all of the volunteer doctors are following our treatment guidelines. That if there are any reasons to change the first line of treatment to go to something else, that our float is able to see if, first, do we have that medication? Second, can we continue that medication? Because there are some other medications that, yes, it would be great for us to use If a doctor came from their country and that was their first line, it's not saying that we wouldn't use that, but if we don't have access to it long term, it's not actually a better option. So with that, we're able to really care for and pay attention to the quality of care that we're giving. And we lean a lot on our float for that. And we also track all of our patients electronically. So we have an online records of all of our patients so that our lead medical providers at the end of every week, whoever was floating would actually go through every single patient and make sure that anyone who needs follow-up care has an appointment made in the system for the next time that we visit in 12 weeks. So then we would already pre-pack their medication. We would look at the patient notes to make sure that our guidelines were followed. So then they're able that way to kind of just reaffirm what they were doing at the clinic by watching all of the providers. When medical providers come, they also have a provider orientation so that our lead medical provider can go over a little bit more of what they're expecting to see, what everyone's role would be in the emergency, if there is an emergency, because that changes on a weekly basis. There are weeks where we have no volunteer doctors. There are weeks where we have 3 volunteer doctors, one who runs the emergency room in their department and one who is a disease specialist. So we want to take advantage of that. So we'll always kind of just have a small orientation just for the providers on top of all the other volunteer orientations so that we can utilize everyone's skill set. And then for non-medical volunteers or for medical student volunteers, we just have a strict policy of not practicing outside of your scope. So if there was a first-year medical student who had never given a birth control injection, this was not the appropriate time to practice. But if we have a final year medical student who's already finished their clinicals, has done all of these things, and has done them with supervision, we've gone over their references, we've gone over their CV, we know they've passed that, they're here for their medical elective, so we would be happy to supervise something that they would have supervised back home. So we're able to take advantage of all the different volunteers that come to us, but we also, on top of that, not only do we accept them, we put the responsibility on ourselves for looking at all of their materials to make sure their output is as high and appropriate as possible in the community.
I mean, it sounds like you've done such an amazing job in terms of like the way you've organized this really complex system of having all of these volunteers and doctors and other medical providers come in and provide care and access to this community. And you were mentioning that there's the medical lead that is able to stay there, for 6 to 9 months. I'm wondering, like, what are some of the requirements for physicians to join the team or become that medical lead? I'm thinking about like visas and how do they stay there that long? Malpractice insurance. Do they need an active medical license? Like, what's involved there?
So for our lead medical providers, we typically have 4 to 6 lead medical providers at a time. Part of their job is providing in the clinic. Part of their job is improving the clinic operations, or, if it's their week, to float, which is going around all the other providers, and also to mentor to our students. They need to have at least 2 years of clinical experience. Typically, it's easier for younger doctors to fill this position, as it's easier for them to relocate to a new country and work with us for that period of time. So right now we have doctors who are our lead medical providers from Argentina and from Russia and the Netherlands and from Portugal. So we have a very diverse team, and it's really nice because they're able to learn from each other, and they're also able to support each other through just working with all these different countries. But they are younger. They all have a minimum of 2 years experience. And then also we need an active medical license, because then what I do as the executive director is I would, with their information, as well as volunteer providers. We have volunteers that can come for a minimum of a week. So there are quite a few doctor volunteers this week with us. So I took also their medical license, their diploma, and I bring that to the Ministry of Health every 6 months. And then they actually make a resolution. It's a resolution to a law that covers these doctors providing to the patients. So then they're legally licensed to practice medicine in Panama with our patient population, with our clinic calendar. So right now, the community that the team is, those people are licensed to practice medicine in that community for that specific day. So insurance is not needed, as that's actually something that we cover, and that's our responsibility as an organization to be able to provide to these patients.
Wow. Okay. And so it's part of the organization's policy to have all of those things really in place for the providers when they arrive or when they get there so that they're able to kind of focus in, it sounds like, on their clinical work.
Exactly. So we do all of that. And then regarding the visa, so technically they're not a contracted employee with us because these are long-term volunteers, and the Panamanian government sees volunteering in Panama as a tourism activity. So what that means is that they would just come in like a short-term volunteer would under the tourism box as they're volunteering with floating doctors, because we're not providing a salary. We're providing room and board. And we also provide a very small living stipend, but that basically is just the funds to cover the weekend expenses of enjoying the activities in Bocas with snorkeling, the restaurants, music. So they're not under a salary. They're not contracted. They don't need a work visa. It's seen as a long-term volunteer opportunity. And then what we do with that is also we provide, after every 22 weeks, we provide $150 as a travel support, and then also a paid Friday or Monday off. And then that's when our team does like their visa runs. So they would go to Costa Rica, typically for, it's just 72 hours. So they would leave a Friday morning and come back a Sunday afternoon, and that would be their 72 hours.
Okay. Okay. So then how does that work, I guess, for your lead providers who are at 9 and 12 months, who are there for so long?
They would also do the visa run, and some would just need multiple visa runs.
Okay. I'm guessing it also depends on their country that they're coming from and what stipulations the country might have in terms of the visa. Being a nomad, I'm just like the runs and
exactly. Yeah.
And these things are like my bread and butter. So I'm like, how are they doing it?
How does it work? It's kind of funny because I've had a lot of meetings about it, because I always got, like, when I first came, I was a little nervous about it. And it's hard in Panama where you see quite a few different answers. But our medical director, he was from Argentina. So he had signed a 2-year contract. And so with that, as he was one of our management team members, we actually covered the cost of his residency as he was working with us for over 2 years. He was a medical director of long-term staff. But then at the same time, we had a health education coordinator, and she was here. She originally was only coming for a year and then ended up extending. So it didn't come up in conversation. But since she was from Argentina, basically around every 70 to 80 days, she would leave to go to Costa Rica for the weekends, and then she would come back, and she had no problems and ended up doing that for about 2 years.
And I mean, for people who don't know, Bocas is so close to the Costa Rica border that it makes it a pretty easy thing to do. It's
an easy, cheap way of travel. It's something that we have explored other options. And for anyone less than a year, the visa run is just the way to go. And then for those that are staying more than a year, I try to look into other options with a temporary residency or some sort of other option with the visa. Or some people end up just traveling, wanting to be here longer, but they also, I have my sister getting married, so I want to have a 5-week kind of just time to go back. So it's really on a per person basis, but I would say it's not a barrier by any means.
Absolutely. So it's amazing. I think the work that Floating Doctors is doing in the community here in Bocas. And I'm wondering, with all that you've done in terms of the organization, the strategy, the finance, the communication, and community development, what advice would you give to physicians who are interested in starting their own sustainable NGO internationally, particularly in remote and underserved areas?
The biggest advice that I really think I would give, or I'd want to kind of just like almost like reinforce, is just not to go in with your doctor hat on, letting people know what the problem is. I think that's a really dangerous approach, because it almost sounds like an accusation or judging or like, you have these problems, you have this, like not to go in with those you statements, but to go in wanting to learn and wanting to understand, and then just consistency. There's quite a few one-time medical missions, and it's really hard to get long-term support from the community going there once and not returning. And it's also hard for yourself to get ongoing support from donors, from partners, from stakeholders, because they're not going to see a long-term impact. They're going to see that one-time effort, and they're not going to know the follow-up on it. They're not going to know, were these things long-term? Were these helpful? Did this cause more problems? Did the teachers agree with it? Did everyone have to leave school that day? There's just so many questions that you can't know with a one-time medical mission. So really just anyone that wants to, I think it's a great opportunity. There's so much need, and more people to help address that need is necessary, is needed, just appreciated. But as hard as it may be, like I wouldn't go in with just kind of like a narrow, like, okay, I see this problem. I would want to go in with that. I hear this is your problem. I understand you're saying this. I'm here just to understand how I can support you. What does that look like for me supporting you? So then that way you're not even hearing what they need and saying, oh, I can do this. What do you want from me? What could you see me doing? How could you see me supporting? If you had a local doctor, what would you want from them? Is there a local doctor that you would want me to help train? So just, you're not trying to make them dependent on you. You're not trying to say, you need me for this. Trying to see how you can support this community to have better access to healthcare, which may or may not be that person. It's dependent on the community.
I think about what you said earlier, and you talked about being partners and having a partnership. And it sounds like that's the most important aspect. It's like, how can you form this partnership where you're really helping and bringing benefit and not going in being the expert, which for many providers, sometimes something that we have to work on. But no, I think that's beautifully stated and definitely understandable. Given that you are the executive director, what are the future goals and plans for Floating Doctor? How do you envision expanding or evolving in the next coming years?
Right now, I would say one of the biggest goals, one of the biggest kind of strategies we're trying to bring to our current operations is enhancing our training programs for local health workers and also developing more sustainable community development initiatives. So what this means is that we are trying to have a bigger presence in the communities through these initiatives, not just the 12-week clinic. So we're working on training the local midwives. We're working on identifying some local nurses in Bocastown that could work at our base clinic on Fridays. We're not only training them, we're supporting the school they're already getting. And then we're also fostering the sense of giving back to their people. Another big project we're working on, and I have a goal of expanding this, is we are currently finalizing an outpost in Quebrada Sol, which is one of the communities that's about 90 minutes away. And what that means is it's basically a little health center. So we have a building there where we're able to see patients in this building. And we're also able to host 2 to 4 volunteers there. So this is really great for us because now we have a place where we can actually kind of be when we're there. Because normally when we go to a community, we sleep in hammocks, just kind of under somebody's house or in the communal kind of laid out area in the middle of the community, it's called a rancho. It's almost like a big picnic building shed, and everyone hangs up their hammocks there. We have to have chefs, or we hire local ladies to cook for us during that. We have to bring our own water. We don't want to be a burden on their community. We don't want to take away water. We don't want to take away, if they have power, most don't. We don't want to take kids out of the school just to see them, but if we need the school. So there's a lot of barriers that we're currently facing, but with this outpost, we have a clinic room. We have beds to sleep in. We have a very small basic kitchen. We have a restroom. We have water collection. So we're going there every month right now so that we're also able to prevent a lot of the problems that we see when we go every 12 weeks. So one of the biggest goals we have is making 2 or 3 more outposts and putting them in strategically located communities or areas that other communities have access to. Then that way, we're still bringing the doctors to the people. We're still understanding that these are very remote communities. They're on the coast. They don't have access to coming to the main hospital. But if we have little health centers spread out, we can still have volunteers, and almost, every week we could split up the amount of volunteers to have smaller teams in these communities that just work there kind of full time for the week. They go on a Monday, they come back Thursday, and then we're really able to be a more ongoing presence in the communities.
Beautiful. I mean, it's really amazing. And just to let you know too, just talking to other locals here in Boca's Town, they talk about floating doctors and have such amazing things to say just about the work that you do in the community. So thank you so much just for coming on, for telling us about this wonderful organization, for taking the time and the having the space to share your expertise with us today. And before we wrap up, do you have any kind of final thoughts or advice for listeners who, like you, want to contribute to the betterment of at-risk populations through medical missions?
I would just say that first, well, thank you for having me. I think it's really important to be able to share the work that we're doing. And I feel honored that you set me up with this space. So I appreciate the time. And really the biggest thing that I can end this with is just emphasizing the importance of volunteering. I understand that medical volunteering may not be for everyone, but there are so many organizations to volunteer with. And it's each individual's responsibility to do their due diligence and make sure that organization is making an impact, is working with the community, is not providing unwanted infrastructure that the community has to kind of uphold themselves. So do your due diligence, but get out there and volunteer.
Yes, yes. And for those wanting to learn more about you, Sam, and about floating doctors, where can our listeners find you?
So you guys can go to floatingdoctors.com and you'll see a little bit of an overview of all of our programs, what we're doing. If you wanted to volunteer, if you wanted to work with us as a fellowship, and then you can also find my contact information on the Contact Us page. My name is Samantha Horn and my email is sam@floatingdoctors.com, but you can see that there too if you don't write it down now.
Beautiful. Thank you so much, Sam. I so appreciate you. That concludes today's episode of The Physician's Guide to Doctoring. Thank you for joining us. And this conversation has been extremely impactful, and I'm hoping that it can really help other doctors think more about volunteerism internationally and community development.
Thank you so much. I appreciate it.
Thanks for listening. I have a favor to ask. You listened to the episode until the end, which means you either fell asleep or you really liked the episode. So please share it or like it or comment on a social media post or write us a 5-star review. Something. It would really help me out. And maybe what you learned from this episode can help someone else too. The views expressed in this episode are those of the interviewer and interviewee and don't represent the views of their employer or even their significant other. Even though the magic of podcasting make it sound like I'm talking directly to you. This is not a doctor-patient relationship, and this is not medical advice, or financial advice, or really any advice. Thank us again for listening to The Physician's Guide to Doctoring.